Hey everyone, welcome back to another Fun Fact Friday live here at University Animal Clinic. I'm Dr. Saya, and per your request, today we're talking about Addison's disease in our dogs. Addison's disease, although it's not rare, it's not super common, but it's good to know about because one of the main ways it presents is kind of in a crisis, because unfortunately most of the other symptoms you will see at home are very nondescript. Things like lethargy, weight loss that you're not trying to lose weight that you can't explain, diarrhea sometimes, changes in thirst, usually increased thirst. So it's very subtle. So what is Addison's? It's also called hypoadrenocorticism. So it's kind of the opposite of Cushing's disease, which we've talked about before. And it is a reduction in hormone production from the adrenal glands, which sit right above the kidneys. And these two main hormones that they produce is cortisol, which we all know as the stress hormone. It's produced when we're under stress, and it can act similar to a steroid, and then aldosterone. And this regulates your sodium and your potassium, which has to do with your fluids, how well you are hydrated. And so these two hormones are produced normally from the adrenal gland. And so when you have Addison's disease, you would have reduced production of these two hormones. And so how do our dogs have Addison's? Usually it's an immune-mediated destruction of part of the cortices or part of the adrenal gland that produces the hormone. Sometimes it can be from tumors. Sometimes it can be medication driven if we're treating Cushing's disease, because it's the opposite. We can make it go too far and we can do it. Or steroids, when we give too much steroids, sometimes it can present as Addison's disease that way. But usually for most of our pets, it's immune mediated, and usually this is genetically driven. So this is something passed down from the parents, and it has to do with breeding. So again, we talked about kind of what you'll see. It can be nondescript, lethargy, diarrhea, drinking changes, but it's kind of, not something that we are very descriptive or very specific. But what we can see is what we call an Addisonian crisis. And this is usually when we see a pet come in collapsed or with sudden weakness, things like that. And that's because they get such an imbalance in that sodium and potassium that it can cause them to become very weak and fall over and collapse suddenly. And so how do we diagnose this? We can get a very strong inkling, especially when we see this Addisonian crisis and we do blood work and we find electrolyte abnormalities. We get a very strong suspicion. And then we do a test called an ACTH stimulation test. And that is the confirmatory test for Addison's to confirm that that's what we have. And then treatment is actually quite easy and well tolerated. It's an injection of DOCP or it's a really long name, but we can always get into that later if you really want to know what it's called, but it's pretty long. It's a shot that's given every 3 to 4 weeks, usually around 28 days. And this is to replace some of those, that aldosterone that we are missing. We also sometimes can give steroids in times of stress, because again, we are changing how much steroid is in the body with this medication and with the treatment of this disease. So sometimes we need to give back a little bit when we have a crisis or a stressful event. We're having a lot of people over for Thanksgiving. Our Addisonian patients will often give a little steroid in those situations. But this is actually a disease that has a very good prognosis, because once we diagnose it properly, the treatment's very easily given. It's an injection once a month, about roughly, well tolerated, with very few side effects. So it's actually not a bad disease to have and treat. So not rare, but not super common. We see it often enough. It's very breed specific. There's a list of breeds that can have it, and you can probably find that online because of the genetic component of it. We see it in some poodles, some labs, cocker spaniels, and duck trolling retrievers, for whatever reason, are high up on the list for Addison's disease. So I hope you found this interesting. It's a disease that not a lot of people know about. It also happens in other species. Horses and people can have this type of disease as well, the destruction of the adrenal glands. So if you like this, give it a thumbs up. This was a request from you guys, so please keep them coming. I always forget what you guys might want to hear about or what I've talked about in the last couple years. So leave me the comments below, because I always want to talk about what you want to hear about. And I hope to see you guys next week.